Ever wondered how your ears can provide a window to your overall health? In the fascinating world of human biology, our ears do more than just help us hear. They can act as subtle indicators of various health issues. Conditions like persistent earache, ringing in the ears, hearing loss, and even balance issues could signal deeper health problems. So, don't just listen with your ears, listen to them. Dive in as we explore how your ears can tell you more about your health than you might think. First off, persistent earaches. They're more than just a nuisance. When an earache lingers, it's not something to be shrugged off. It's your body's way of signaling that something might be wrong. Earaches can range from a dull, throbbing pain to a sharp, piercing sensation. They may be intermittent or constant, but the key thing to remember is this: if it's persistent, it's important. Persistent earaches could be an indication of an infection. This may be a middle ear infection, also known as otitis media, or an outer ear infection, known as otitis externa or swimmer's ear. These can result from a variety of causes such as bacteria, viruses, or even allergies. Left untreated, these infections can lead to serious complications, including hearing loss or more systemic infections. Another potential cause of a persistent earache is a disorder of the temporomandibular joint, often referred to as TMJ. This joint connects your jawbone to your skull, and issues with it can result in pain that radiates into your ear. TMJ disorders can be triggered by a variety of factors from grinding your teeth to arthritis. And let's not forget, although rare, a persistent earache could even indicate the presence of a tumor. These can be benign, like an acoustic neuroma, or malignant, like a parotid gland tumor. While it's important not to jump to conclusions or get lost in a spiral of worry, it's equally important to take persistent symptoms seriously. To summarize, a persistent earache is not just an annoyance, it's a signal from your body that something may be amiss. It could be an infection, a TMJ disorder, or even a tumor. The key is to listen to what your body is telling you and take action. Don't let fear or busy schedules prevent you from seeking medical help. So if you're experiencing a persistent earache, it might be time to see a doctor. After all, it's better to be safe than sorry when it comes to your health. Ever experienced a ringing sensation in your ears? If you have, you're not alone. This is a common phenomenon known as tinnitus, a condition that affects approximately 1 in 5 people. It's that persistent, often irritating sound that seems to originate from within your ears or head. It can be a constant hum, a ringing, buzzing, hissing, or even a whistling sound. While it's primarily associated with the ears, tinnitus is actually a symptom rather than a disease in itself. It's a signal that something isn't quite right within the auditory system, which includes not just your ears, but also the nerves connected to them and the parts of the brain that process sound. So what causes this ringing sound? It can be due to a variety of factors. The most common cause is exposure to loud noise. This can be a one-off exposure, like at a rock concert or a sudden loud bang, or it can be due to sustained exposure over time, like working in a noisy environment. Age-related hearing loss can also cause tinnitus. As we age, the tiny hair cells in our inner ear that help transmit sound to the brain start to break down, which can result in a ringing sound. Moreover, certain medications, such as high-dose aspirin, certain antibiotics, and chemotherapy drugs, can also cause tinnitus. Sometimes tinnitus can be a symptom of a more serious underlying condition. For example, it could be a sign of a circulatory system disorder like high blood pressure or atherosclerosis. It can also be a result of an ear injury or a disorder like Meniere's disease, which affects the inner ear. So if you're experiencing persistent ringing in your ears, it's important to get it checked out. While it might be a harmless, albeit annoying side effect of a loud concert, it could also be an indication of something more serious. Remember, your ears are a crucial part of your overall health, and their signals should never be ignored. Persistent ringing in your ears should never be ignored. Hearing loss isn't just about turning up the TV volume. It's a complex health issue that can stem from various causes and have far-reaching implications. One of the most common causes of hearing loss is age. As we grow older, the sensitive hair cells in our inner ear that transmit sound to our brain gradually deteriorate. This process, known as presbycusis, is a natural part of aging, but it can significantly impact our ability to perceive sound. Loud noise exposure is another leading cause. Whether it's from a noisy workplace, blaring music, or even a single loud bang, our ears can take a beating, leading to what's called noise-induced hearing loss. But did you know that certain medications, infections, and even genetics can also contribute to hearing impairment? Yes, it's true. Some of us are born with a predisposition to hearing loss, while others might experience it due to a bout of severe ear infection or as a side effect of certain drugs. Now, let's talk about the implications. Beyond the obvious difficulties with communication, hearing loss can also contribute to cognitive decline. Studies have shown a correlation between hearing loss and decreased cognitive function, including memory problems and difficulties with concentration. This is believed to be because the brain has to work harder to interpret the sounds it hears, leaving less energy for other cognitive tasks. Moreover, hearing loss can also have a significant impact on our mental health. It's not uncommon for people with hearing impairment to feel isolated or depressed. The struggle to communicate can lead to feelings of frustration and loneliness, which can, in turn, contribute to depression. But the good news is, most forms of hearing loss can be managed with the right treatment and lifestyle changes. Regular hearing checks, protecting your ears from loud noise, and seeking timely medical attention when you notice changes in your hearing can go a long way in maintaining your ear health. Remember, hearing loss isn't just an inconvenience, it's a health indicator. So, let's all pledge to listen to our ears and take good care of them. After all, good health is the best wealth. Feeling dizzy? Your ears might be trying to tell you something. It's a common misconception that our ears are just for hearing. But in reality, they play a crucial role in maintaining our balance too. Delve deeper into your ear and you'll find the inner ear, an intricate labyrinth of tiny organs and structures. It's here that the magic of balance happens. The inner ear contains the vestibular system, which includes 3 fluid-filled semicircular canals that act like a gyroscope, sending signals to the brain about the body's motion and orientation in space. These signals help you stay upright and move smoothly. But what happens when something goes wrong in this delicate system? You may experience vertigo, a sensation of feeling off balance, or a feeling that you or your surroundings are spinning or moving. Vertigo is not a condition in itself, but a symptom of an underlying issue in the inner ear. One of these issues could be Meniere's disease, a disorder of the inner ear that can lead to dizzy spells and hearing loss. It's often characterized by sudden severe vertigo attacks that can last for hours, along with tinnitus or a feeling of fullness in the ear. Another possible cause is vestibular neuritis, an inflammation of the inner ear usually caused by a viral infection. This condition can result in severe vertigo, along with other symptoms such as nausea and problems with balance. While these conditions might sound scary, they're often treatable with the right medical intervention. Whether it's medication, physical therapy, or in some cases surgery, there are ways to manage these balance issues and improve your quality of life. It's important to remember that if you're experiencing persistent vertigo or balance problems, don't ignore these symptoms. They could be your body's way of telling you that something's not right in your inner ear. When it comes to balance, your ears play a key role and issues shouldn't be overlooked. So, listen to your ears. They might be trying to tell you more than you think. Your ears do more than just hear, they communicate. Just like a well-tuned radio, they pick up signals, interpret them, and send them off to your brain. But sometimes they do more than just relay sounds. They can give you clues about your health, acting like little biological warning systems. Let's take a quick journey back through our discussion. Persistent earaches are not to be taken lightly, as they could be a sign of various health conditions, from minor infections to more serious issues like tumors. Ringing in the ears, also known as tinnitus, could indicate exposure to loud noise, or it could be a symptom of health problems like high blood pressure or even diabetes. Hearing loss is often associated with old age, but it can also be caused by a range of health issues like autoimmune diseases or even certain medications. And let's not forget about vertigo and balance issues. If you're feeling dizzy or off balance, your ears might be hinting at problems like Meniere's disease or benign paroxysmal positional vertigo. So, let's not just listen with our ears, let's listen to them. They might be trying to tell us something. They might be whispering about a health issue that's creeping up on us, giving us a chance to act before it's too late. The next time your ears ring, ache, or mess with your balance, remember, they might be trying to tell you something about your health. Listen to them.